The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. Today, we're going to discuss the topic that is a dread among women, and that's the topic of menopause. And why is that such a dreaded condition among women? Because that's when a woman's hormones no longer are produced by her ovaries, and she stops her periods altogether, which you might say, well, that'd be great. I'm tired of having periods. But unfortunately, when menopause occurs, it is associated with a host of adverse health symptoms. Ladies, you may have seen your mother go through it. You may be going through it now, or you may see your daughter now. You may be older and your daughter may be going through it. And these are the symptoms that you're experiencing. One, you're having hot flashes, night sweats. You're experiencing fatigue, maybe weight gain. You're also having some problems with brain fog. Maybe you're having anxiety symptoms or depression or loss of romantic moods and inclinations. You got bones that are thinning out. You got osteoporosis or osteopenia. You don't sleep well. You don't think well. You're having problems with joint and muscle aches and pains. You're just not doing well. You're sick and tired of being sick and tired. So you end up going to your physician and trying to get some relief. Now, mind you, menopause can be natural. It's natural. Inevitably, a woman will go through puberty, begin to have her cycles, end up getting married, having children, and then those cycles are governed by the hormones made by the ovaries. You have two ovaries, and those ovaries make the hormones. Estrogen hormones and progesterone hormones. Also, a little bit of testosterone is made for women. Interestingly enough, you know when a woman makes the testosterone, which increases her romantic moods and inclinations, the day she ovulates, the day she gives off an egg, all of a sudden the guy you've been living with, the man you've been living with, looks very, very attractive and very desirable. God kind of built that in to make sure that there is reproduction of the species, and that's what that causes. So women's hormones go through a pattern. None when you're young, go through puberty, they rise up and then gradually decline until you get to the change of life, menopause. That means the menstrual cycles pause. They stop. And true menopause is 12 months without having a menstrual period. This routinely happens at the age of 50. This would be the average age of menopause. In some women, it happens earlier. It could happen in the early 40s, mid-40s. Could happen in the her early 50s or mid-50s. But in general, 50 is the average age a woman goes through menopause. And the hormone levels, because they have declined to nothing, it adversely affects the way a woman feels. So you get all these symptoms that we've just talked about. Now, besides natural menopause, menopause can also occur right after a hysterectomy or a tubal ligation. Within a year or two of a tubal ligation, because part of the blood circulation is cut off to the ovaries, women will often get what we call post-tubal ligation syndrome, which are symptoms that are consistent with premenopause. They get the hot flashes, the night sweats, the decline in romantic moods and inclinations, the anxiety, the depression, these sort of things. So it can be a surgical menopause or it can be a natural menopause. It's all the same. The hormones have stopped, your natural hormones. So you go to see your physician, and the physicians historically have given several different preparations. One was Premarin, which is derived from pregnant mare urine. It's estrogen hormones, estrone primarily, that is extracted from pregnant mare urine. Literally, the drug companies collect the urine and extract out the hormones because the hormones are excreted in the urine. And they call it Premarin because it stands for pregnant mare's mare urine. Premarin, and that's pregnant mare urine. That's where the hormones come from. They also will give Provera, and Provera is a counterfeit progesterone. It's medroxyprogesterone. It's not the progesterone your body makes. Remember, in a woman's menstrual cycle, once you have your period and the period's over, your ovaries begin to make estrogen hormones, and those gradually increase over the month. They proliferate the inner lining of the womb, preparing it for a pregnancy. In the middle of the cycle, at day 14 or 15, a woman will ovulate, give off an ovum, the egg. And where the egg is given off, that's called the corpus luteum, it produces progesterone. That matures the inner lining of the womb, and there's a balance between the estrogen and the progesterone. If a pregnancy occurs, then the ovaries continue to make that progesterone, and eventually the baby's placenta makes all the hormones that occur during a woman's pregnancy. And by the end of the pregnancy, she's making very high levels of progesterone because progesterone promotes gestation. It promotes pregnancy. So progesterone is the balancing hormone to the estrogen hormones. And there are three estrogen hormones that women make: estrone, estriol, estradiol. And when they're balanced, a woman has normal cycles, say every 28 to 30 days. And the cycles may last 3 to 5 days and be mild to moderate. But as a woman marches through her menstrual cycle, she becomes estrogen dominant. She doesn't ovulate every month when she gets into her late 30s and early 40s. And when she doesn't ovulate, she makes no progesterone to balance the estrogen, which is the proliferative hormone, which proliferates the inner lining of the womb. So when she does end up sloughing the inner lining of the womb and having a period, it becomes heavier and heavier. She gets cramps, severe cramps and clotting, and then breakthrough bleeding. And she'll get mood swings. It's called premenstrual symptoms, the anxiety, the depression, the fluid retention, the weight gain, the breast tenderness, headaches, migraine headaches. She calls that premenstrual symptom. And then when she has her period, all of a sudden it's gone and she feels normal again. And this all has to do with your hormones. Hormones govern both male and female life. But in women, because they're ovulating on a monthly basis, their hormones have to come into balance every month. And women tend to be more attuned to their health than men do because men simply make testosterone, and that peaks in their early 20s and then gradually declines over a lifetime. They don't have peaks and flows, highs and lows every month of testosterone. They get a certain level and then it gradually declines, so they're oftentimes not really attuned to the changes they have in their testosterone in a short period. Over a long period of time, they can look back and see that that's made a big change. So what do we do? If we're not going to take the counterfeit hormones that drug companies offer, what is the alternative to that? Well, the alternative is to use the same identical hormones that your body made to begin with. Natural estrogen, natural progesterone. We call these biologically identical hormones or bioidentical hormones. And the bioidentical hormones, because they're the same exact chemical structure as the hormones your body made, and by the way, these bioidentical hormones are derived from plant sources and converted in a lab to be biologically identical. So they are made in a lab. So in that sense, you can say, well, they're synthetic, but they're not, but they're bioidentical. You know, if you could take wood or you could take concrete and make a progesterone molecule out of it, it would still be progesterone. If you could make estrogen out of it, it would still be estrogen. As long as it's biologically the same, that's the key ingredient. So what we recommend in women as they march through their menstrual life and begin to have hormonal imbalances, initially we will start women on natural progesterone, day 15 through 28. And this will help alleviate, it will help even eliminate these premenstrual symptoms that occur, and it will help balance out the hormones so women don't end up getting the breakthrough bleeding and the severe clotting that they get and the cramping and the uterine fibroids that occur that lead them to see their OB-GYN who says, I've got a solution. We'll just cut your uterus out, honey. You won't have any more bleeding problems. The problem is not with the uterus. The problem is with the hormone imbalance. That has got to be squared away, and I can't encourage you enough. If you're having hormonal changes, your periods have become heavier and longer, you're having breakthrough bleeding, please come see us, and we can get you on some natural progesterone and prevent you from having to go through a hysterectomy. There's no reason in the world any woman should have to go through a hysterectomy as a natural part of life. Remember, OB-GYN doctors are surgeons. So they deliver babies the first half of their career. The last half of their career, historically, they do what? They do hysterectomies. That's the warp and woof of their trade. As a matter of fact, I worked for an OB-GYN one time during my residency program who told me that he went from room to room prospecting for hysterectomies, potential hysterectomies. That's what we look for. We don't ever prospect to get a woman have a hysterectomy. What we do is we find women who have menstrual irregularities and we balance out their hormones with natural progesterone. And then as they march through their menstrual life, we may add natural estrogen and put those in balance so they can go right through the menopause without having all these significant problems of mood swings and weight gain and migraine headaches and hot flashes and night sweats and loss of romantic moods and inclinations. We can prevent that very easily. And that's what we specialize here at the Hotze Health and Wellness Center. By the way, thyroid plays a significant role in a woman's health as she marches through her menstrual life, because thyroid hormones are what enable the cells to produce and use energy. And when you don't make enough energy, your cells don't function as well. You end up running low voltage. And that means your ovaries aren't going to produce the hormones right, your brain's not going to think right, heart's not going to work well. It's so very important to keep good metabolic rate. And thyroid does that. And the balancing of the hormones helps allow the thyroid to be able to utilize properly in your cells so you produce the energy that you need. So if any of you are experiencing any type of hormonal or menstrual irregularities, I don't care if you're in your, if you've got teenagers that are having problems in irregular periods. I just saw a young girl today, 19 years old, who was having menstrual irregularities. Her periods were never regular. Sometimes they were heavy, sometimes they were light. She had anxiety and depression associated with it, headaches. I mean, she's a young girl, 19. Well, how many other girls? And so if she hadn't come here and her parents had taken her to see an OB-GYN, he would have put her on birth control pills, which are counterfeit hormones, which shut off your natural hormones altogether and have a host of health problems. We gave her natural progesterone. She needs a little bit of thyroid. Her mom and her grandmother both had thyroid problems. So we gave her a little bit of thyroid, which is going to help the ovaries function well because they're going to have the energy they need. So this is a young girl, women in midlife, after birth, childbirth. This is very common for women after childbirth to have significant hormonal changes and hormonal declines where things change, their energy level declines and the periods change. And so that's very important for hormonal balance after your child, after you have your babies. That's really very important for women. And then as you march towards the change of life or menopause, it's very important to balance out your hormones. And afterwards, you want to stay healthy and strong and feel vibrant and young. If you want to do that, you got to keep your hormone levels up where they were when you were younger so you feel well. And you won't menstruate. You'll be fine, but you will be feeling well, healthy and well. And that's our goal here, is for both our female guests and our male guests to feel healthy and well naturally so they have energy, vitality, and enthusiasm for life. Well, if you would like to get yourself on a path of health and wellness, then I want to encourage you to give us a call at the phone number on the screen. Talk to one of our new guest consultants. Ask them to send you a copy of our book. My book, Hormones, Health, and Happiness. I have several books, but this book I will be glad to send to you free of charge, and we won't even charge you shipping. I want you to understand how your body works and what can be done naturally to keep you healthy and well. And who doesn't want to be healthy and well as they mature? So if you're willing to get yourself on a path of health and wellness naturally, if you're willing to take charge of your health and invest in your health, then I want to highly encourage you to give us a call, and we're here to partner with you. I'm Dr. Steve Hotze. Thanks so much for joining us today.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.